Good afternoon, everyone. Welcome back. Welcome to the first the Speakers Bureau for the Brain Health Team of 2025. Every other month will be an Alzheimer's speaker. In between, we will have speakers on the other many brain diseases. So please feel free to check the calendars and come on out and support us with the Brain Health Team and all the neighbors, because everybody is touched somehow by any of the various dementias. So, first thing, as I always say, please turn off your cell phones. If you haven't signed in, there are sign-in sheets going around. Please sign in. It's very important for the Alzheimer's Association. Grant money is involved. And if we want speakers to come, we need to support them. Okay? Without any further ado, I'd like to introduce Joan Carl. Joan is with the Duchess Association, and as you all know and support the Alzheimer's Walk, it's always a collection for the Duchess and Ulster Association. So it all goes into here in our goals, and so we appreciate it, and we appreciate you coming out.
Thanks, Ina. Can everybody hear me? Okay, so I'm Joan Carl. I'm a senior manager at the Hudson Valley Hudson Valley chapter of the Alzheimer's Association. We cover from Dutchess down to Westchester and all the counties in between. We have 7 counties. I work out of the Poughkeepsie office. We also have a purchase office. And all our programs and services are for free. On that table, there's a lot of information available, including our chapter brochures. So please take from there any information. The fact sheet that's there will be updated in March. That's when they update our fact sheets. So right now, there are people at a summit, and it is down in Atlanta where it snowed, apparently. And they are learning about new research and new strides in treatment. So if you have any questions, we can wait until the end, or if there's something that's on top of your mind and you want to ask me, have at it. So we're going to talk about communicating effectively. How many of you are caregivers or have been caregivers? So communication, as the individual living with the disease and as it progresses, becomes harder and harder. And these are just talking about, these strategies are talking about how it might make it easier for you dealing with someone who's living with Alzheimer's or another dementia. There are over 70 causes of dementia. Alzheimer's is the most common, and it's the 6th leading cause of death here in the United States. So we're going to talk about how dementia affects communication, because we're communicating all the time. We do it non-verbally, we do it verbally. Sometimes if anybody who's been a teenager, which we all have been, or had teenagers, you understand the eye rolling, and the shrugs and all that. Well, for someone who is living with Alzheimer's or another dementia, it's hard for them to decode that kind of nonverbal as long as you are facing them and speaking directly to them, you wanna watch out, you know, with your hands, with your facial expression. Why am I tingling? Anyway, this is gonna go into that. So we're gonna talk about how a person-centered means that person, that individual who's living with the disease, approach can help with communication. You wanna list strategies to help you communicate well with that person living with dementia. And we're gonna, can you hear me now? Okay. I missed kind of the high pitch down. Identify ways to improve communication with family, friends, and healthcare professionals. You know, too often, people will talk around the individual. They won't talk directly. They'll act like that person's not there. And you've got to remember, that person was someone who worked, who loved, who laughed, who, you know, contributed. Those people are still there, no matter what the stage is. So what is communication? Well, how we tell people about our wants and needs, how we share our thoughts, feelings, and ideas, and how we connect to each other. So every so often you'll get a knowledge check, I'm sorry. So it's asking, which of the following are the ways that people communicate? Talking and listening, attitude and tone of voice, facial expressions and body language, or all of the above? We're always communicating, whether we are consciously aware of it or not, we are communicating. So this next section is going to talk about communication and dementia. Now remember, dementia is an umbrella term. It is not a diagnosis. So if somebody says, well, my husband doesn't have Alzheimer's, he has dementia, that is because it hasn't been identified, the specific dementia. Dementia is a group of symptoms that are affecting that person's daily life. It could be forgetfulness, but that's one of the symptoms that is prevalent in Alzheimer's and other dementias. So we know that Alzheimer's and other dementias cause damage to brain cells, and these changes in the brain affect memory, thinking, behavior, and communication skills. Communication changes are caused by the disease, not the person, and that is so hard when you're the primary caregiver and you get that question over and over again, or you have someone wake you up in the middle of the night to say they're going to work and they've been retired for 20 or 30 years. So and there's information on that table for caregivers too. So communication changes are often the earliest signs of dementia. Difficulty finding the right words. I mean, we all have that. That's normal aging, because then we find the word.
We're all laughing because we all have.
Yeah, everybody does that. Or you walk into the room and you say, what am I doing here? And then you walk back out and you come back and you remember. For a person who is in the throes of dementia, they don't have that recall. Repeating a familiar word, phrase, or story. One of my older brothers passed from mixed dementia. He had frontal temporal dementia, which now is in the news because of Bruce Willis, but he also had vascular dementia. And when we would go out to see him, our oldest brother and our cousins, you know, my cousins would say, we're always talking about the same thing. And I said, you know, for 2 hours, it's no skin off your nose to be in there to talk about hunting or whatever he wants to talk about. Make him laugh, share those memories, whatever comes up. Forgetting what they were talking about in the middle of a sentence. We all do that. Describing an item when they can't think of the word for it. So a watch becomes the hand clock. It makes sense, but it's not the correct name. Difficulty organizing words in a way that makes sense. So they kind of stumble and may leave out some, verbs or whatever. Going back to speaking in their native language, we hear this a lot. People will fall back into Spanish or German or whatever their native language is. And they speak less often because they realize they're not keeping up. And so they're scared, they're angry, they're embarrassed, so they kind of withdraw. And using hand gestures more than speaking. So being from an Italian-American household, we used hand gestures a lot. But it had nothing to do with Alzheimer's or anything. Some of them were not so pleasant. So this is talking about using a person-centered approach to communication because it's all on that individual living with the disease. It means you use what you know about the person, if it's a relative, it's a friend, and adjust how you care for them and communicate with them based on their unique abilities and preferences. This approach can help you communicate with someone living with dementia, and it takes a lot of stress away from them too. And always treat them with respect and dignity. Use your knowledge of the person's likes, dislikes, and communication preferences. Call the person by the preferred name. And like I said, avoid talking about the person as if they're not there. Give them that respect. Avoid correcting them and validate their feelings. And you want to talk directly to that person. If that person's standing up, you stand up, make eye contact. If they're sitting down, plant yourself. Don't come up from behind and start talking to them. And you want to speak slowly and clearly in a calm tone of voice. You don't want to be scolding or anything. And acknowledge what the person says, because sometimes it may be hard for them to articulate. So you have to use your patience to kind of translate what they're trying to say as they progress. Help them engage in conversations that are meaning to them. Like with my brother, he loved talking about his friend Justin. They all these guys grew up together, went to school together, they did everything together. Two of them even joined the Marines together. They would go hunting, and they would, if you know anything about deer hunting, you have a tree stand and everything. And Justin decided he had a discarded chair in the woods. He threw it up in a tree. Well, of course, the tree was not going to be able to hold Justin, and he came falling down. And my brother would roar with that memory. And every time we were there, he would bring that up. And, my cousin said, well, but he always talked about Justin. He said, who cares? Just go with it. Have conversations about family and friends in your lives, including things you've done together. And that's what my cousins and my oldest brother did with my brother. And I did too, but he was older. And give them time to decide what they want to say. Avoid interrupting. Try not to speak for them. You can ask them, do you want me to help? And if they say no, then give them the time to speak. And give them choices, but not a lot. And connect in that moment. Because they have moments of clarity. And they can realize that something's amiss if you're treating them disrespectfully. And you want to limit distractions. You want to find a quiet place that has few distractions. You know, no grandchildren around or barking yappy dogs. Get rid of extra noise and visual distractions. You want to have one-on-one conversations. Keep it simple. And turn off or turn down the sound of the TV. And put away your phone. You know, playing music that is of the period when the person was young. My brothers all thought they were Paul Anka or, you know, Dion. And so he responded to the music back then, you know, the Everly Brothers and all those guys. And you want to use nonverbal communication. Use positive body language and facial expressions. Don't smirk. Don't shrug your shoulders. Don't clench your fists. You want to use hand gestures like pointing to an object to help. And you want to make eye contact and use gentle physical contact. Be careful because some people become hypersensitive, so they might not want to be led by the elbow or touched. So you have to try to see what works and what doesn't work. And you want to use touch and sight and sounds and tastes as other ways to communicate. You know, they loved, you know, a certain dish. If you can make that dish, bring that smell into the area, that could help them. So these two folks are caregivers.
Some of the changes I noticed in the middle stages with mom would be she would start to point to things versus saying them. So for instance, she had a fascination for airplanes all her life. So we would be driving and she would just, when she would see one, she would point to the sky. In the early stages, she would say things like, oh, the last one for the night that we see, the last airplane. And the middle stages, it was more just pointing. And so when that would happen, I would say, oh, there's the last one for the night, Mom, right? So I would be that voice for her at that point. I knew what she meant. And so then I tried to supplement it with some words myself, and then maybe she would actually repeat it or say, you know, say something in regards to that. So then I knew she was engaged in that conversation.
When my husband was in the late stage of dementia, I would always sit and talk with him. I would try to use a calm tone of voice. I would always make eye contact, give him hugs, hold his hand. But sometimes it was hard for me to think of new things to tell him. I didn't know if my words were too complex. But one thing that we had always shared was a love of the Harry Potter books. And so I made sure that I always kept a Harry Potter book in his room. And sometimes a visit for us would be holding hands, and I would just read a chapter from the Harry Potter book. And that was actually really connective and important for us because as a couple, we had a lot of memories of reading those stories together. And I also was starting to read those stories with our son. So it felt like this way of making a family memory that I could hold on to and share with both my husband and our son.
She's so young. It's like heartbreaking to know that that's what she had to do. So this is a little vignette. Alonzo's wife, Alicia, is living with Alzheimer's disease and is no longer able to get out of bed on her own. Prior to her diagnosis, she worked at an elementary school as a librarian. Alicia is no longer able to speak, and Alonzo is having a hard time communicating with her. This is making Alonzo feel less connected to Alicia. And you know that as caregivers, you see that. So there are two best tips for success, how Alonzo could try to communicate with Alicia. So we got the holding the hand and reading one of the books, because putting the radio on, that's not him communicating with her. Even though it may be best, it might be tuned to a station that she likes the music. Nothing, and throwing your hands up and saying nothing, he can do nothing, is just giving up. So, holding her hand, talking to her. We had to be careful with my brother because he would squeeze your hand. He became a little aggressive as he progressed. And our one cousin had very bad arthritis, so he had to kind of back off from letting Frank squeeze his hand. And reading one of her favorite books, just like that young woman in the prior video. So for you as the caregiver, you need support too. So you want to talk about your feelings and worries, excuse me, and needs, and be open and honest. Have a difficult conversation when you need to, and stay connected and check in regularly. There's no shame in talking to a therapist about the stress you're under. Call us, we have a 24/7 helpline. There are master level social workers or the equivalent. They are 24/7 and they can talk to you. We have Tara, who is our care consultant for Ulster County, and she's happy to talk to any of you. And she's been here, some of you probably know her. In terms of healthcare professionals, prepare for the appointments. Explain the details and take notes, because the person with the living with the dementia is unable to do that at that point. And think about your environment. Do it when you're with them, do it for yourself too, when you're visiting your own doctor. So as I said, all our programs and resources and services are free. We have the 24/7 helpline, which is on all our material. Local resources are a chapter. If you type alz.org/Hudson Valley, you come right to our website. We have support groups. Some of them are virtual, some of them are in person. We have the Community Resource Finder, which is a partnership with the Alzheimer's Association and AARP. You can connect with us in terms of whatever you need help with, whether it's for care, safety, driving, because taking someone's keys away is one of the hardest things you can do, and the navigator, and of course the educational programs. You can do it online, but don't you like having somebody here talking to you with a pulse? And that's it. Did I go too fast? Should I rewind? Any questions? Yes. Ina's gonna get her steps in.
I was a caregiver to my husband who had frontal lobe dementia, and I know it can be aggressive. But one of the reasons I'm here at Woodland Pond is for my brother to be at his side, because his wife has Parkinson's and Lewy body dementia. So what I learned, I can give to him when he needs, something. What's the difference, big difference between Alzheimer's and Lewy bodies?
Alzheimer's, the hallmarks of Alzheimer's are the two different proteins. It's the amyloid plaque and the tau tangles. They are both proteins that we all have. But unfortunately, with someone who has developed Alzheimer's, they increase. They don't leave the body, because that's one of the reasons why it's so important to get good sleep. Because as we sleep, our brain is taking all that debris from the day, what we did during the day. Lewy bodies are different types of proteins that attack the brain, and they just go in, and because we have 100 billion brain cells, and all of those proteins, if they go unchecked, they kill the connections between those neurons and brain cells, and that's what causes the dementia. Eventually people have trouble not only with memory, they have trouble with their behavior, balance, they have Lewy body, maybe suffering hallucinations.
She is.
So there's, that's the difference. It's just a different, there's overlapping symptoms, but the causes are different.
Another difference is with Alzheimer's, they like to wander. Where Carol, you can't get her out of the house. I mean, really, it's a struggle.
Yeah,
So
it
she's
depends on the
afraid.
individual.
She's afraid,
Yeah, it depends on the individual.
Thank you.
I wanna thank everybody for coming, because I would have been hurt if you didn't show up.
Can I ask you, do certain dementias progress more rapidly than others? And does it change in maybe different populations?
Well, statistically, people who are Hispanic are 1.5 times more prone to develop Alzheimer's than white population. And in the black population, and African American, they're 2 times as likely to develop Alzheimer's. Each person's journey is different. When you look at those 2 communities, it could be genetic, it could be lifestyle, or it could be underlying other health issues. Diabetes, high blood pressure, high cholesterol, and those are being studied even as we speak. Women, out of the almost 7 million people living with Alzheimer's in the United States, make up 2/3 of that population. And it was originally thought because women historically live longer than men. But they're looking into hormones and, just the biology difference between men and women. Yes?
Get my steps.
Yeah, you sure are.
Thank you for coming. first of
Sure.
all. When you talk about the difference between Alzheimer's and Lewy body and the diagnosis, that is done by the doctor observing behavior?
Well, if anybody starts showing what they think are symptoms, and there are a few of the 10 signs on the table. If you start feeling like someone you know or yourself starting to lose concentration, or you have issues finding places when you're driving, you want to go to your primary first, because your primary will do blood work, they'll take your blood pressure, they'll look at all that information to rule out diabetes that may not have been diagnosed, thyroid issues, possibly your medications are interacting. That's why you have to be very careful. If somebody says to you, you should try this supplement because look at my hair, look at my skin, you gotta be very careful because it can interact with your prescriptions, and so you gotta be careful. If your primary looks at all that and they do one of the basic cognitive tests and you pass it, they might tell you to do a clock and make it, show 2 o'clock or whatever, and they might give you like 3 or 4 words, which would terrify me, but, they might say that, to do that, and you pass that, but you're still concerned, and you don't have thyroid issues, you're not B vitamin deficient, you haven't had Lyme, you haven't had a stroke, then that doctor, he or she should recommend that you go to a neurologist who is familiar with Alzheimer's and other forms of dementia. And if you have a doctor who says, well, what do you want? You're 80-something years old, you're 70-something years old, you're in your 90s. What do you want? Drop that doctor like a bad habit and move on to a new doctor, because you need to be listened. You have to be listened. You deserve to be listened.
I asked the question because we had a good friend with Lewy body disease who became quite physically aggressive and violent in the late stages before he died. And we had another friend who was diagnosed with Lewy body disease, but after a while that diagnosis was changed just to Alzheimer's. I just wondered how these diagnoses were made.
Yeah, they'll look, I mean, what they should do is do a PET scan, because that gives more detail of the brain. That can show areas of the brain that are affected. And, you know, the neurologists typically would be the ones to do that.
Do all people with dementia experience anger?
No, it's a different journey for everyone.
They have a definite test for Lewy body. My sister-in-law Carol's a neurologist. What they do, the test defines the Lewy body deposits in the brain.
Yeah, that's the protein.
Yeah. But there's a very definite test because she had it done.
Yeah, diagnostic tests are getting more and more sophisticated. They're looking at biomarkers, they're looking at blood tests, they're looking at spinal taps that can show them, you know, details about what's going on.
My veterinarian thinks my dog is getting some dementia, because sometimes at night she gets very agitated, just walks around very confused.
Could happen, you know. Our pets develop cancer and all, you know, a lot of what we deal with.
Are there any new advances in medications?
Yes. We have 2 medications that are out, Leqembi and not Aduhelm. I'm sorry, I forget the other drug, but they're infusion drugs. And what they do is they go after the amyloid plaque, and they can slow it down a bit and buy the individual some time with, you know, at the stage that they're in. And it's for people who have mild cognitive impairment, or MCI, or someone who's been diagnosed in the early stage of Alzheimer's. So that's where it's most effective. And it buys them time. It actually goes after the amyloid plaque. And so whatever stage they are, it'll buy them time to, you know, be able to enjoy their family without progressing possibly as rapidly. It's not years, you know, it's months. And they're still looking at possibly getting medications that will also go after the tau tangles. But it shows improvement for people, for most people. Some people, you know, with every drug there's risks. You know, there's always a risk, but you'd have to go to an infusion center and be approved. Your insurance might be the biggest barrier.
Do physical disabilities go along with Alzheimer's?
They're looking at people with Down syndrome are more prone to develop Alzheimer's later as they mature. Not everybody. It's like not everybody with Parkinson's will develop Lewy body. So.
Sleep like a rock. Over here, you didn't see me. My sister-in-law has Parkinson's also, and the neurologist told us that for some reason they go together.
Not necessarily for everybody though.
Okay,
Yes.
okay. Yeah, I thought that was interesting. I mean, you know,
That's apparently what Robin Williams had.
yes, absolutely.
And he was like this brilliant person. He was so intelligent. And who knows, it might have been to the point where he had his persona out there and he didn't want anything to disrupt it, and that's why he committed suicide. We'll never know.
In the Down syndrome population, they age quicker. Is that make them more prone to Alzheimer's?
I don't know what makes them more prone, but we know that there are some cases with individuals who have Downs, who are living with Down syndrome, will develop Alzheimer's. Any more?
Joan, I'd like to share, about my mother. It was about 10 or 11 years that she actually progressed, and she hadn't talked in 6 years. And the irony is, when it was my 50th birthday, my father had called me, and he always asked if you want to talk to your mom, and she never, of course, she continued to stare. On that day, he said, she's getting up, she's coming to the phone. She picked up the phone and said, who is this? And I said, it's Ina, Mom, it's my birthday. And she said, I love my Ina, put the phone down, walked away, and for another 3 years, she never said a word. I mean, clear blue.
And, that goes to show, no matter what stage they're in, they're there. With my brother, he was like the closest thing to a delinquent out of the three brothers that I had. My mother was always going up to the high school, because Frank was getting in trouble. And he played football in high school, he boxed in the Navy, and who knows what else he did, when he wasn't around us. However, as he progressed, we saw changes, and we went to see him. I had, loaded my SUV up with my brother and my cousins, and which was a trip, I'm telling you, with 3 Italian guys who grew up together. The conversations. But we got there, and my brother Frank had stopped talking, stopped eating, stopped drinking. At this point, he was all curled up into himself, and my poor sister-in-law was beside herself. So I said to my brother, Tony, I said, why don't you go over to the piano and start playing something? Because like I said, they all thought they were like the Everly Brothers. In fact, they used to play together with guitar and accordion and stuff. So his eyes were closed and everything. And so Tony started playing the piano, and he was talking, and my brother Frank's head came up slowly, his eyes opened wide, and my sister-in-law was astounded, and his head turned toward my brother, and he smiled and tried to talk to Tony. And that was less than a week before he passed. So they're there. He responded not only to the music, he responded to my brother's voice. And whether it was good or bad singing, I don't know. But Frank, was there. He was absolutely there. And so you gotta remember that. As frustrating as being a caregiver is, and I know it's frustrating, because I was a caregiver for my dad who died of cancer, and my sister-in-law who also died of cancer. So I understand the frustration. And with someone who is, like I said, asking you the same question over and over again, or rebelling against possibly taking a bath or changing clothes, that is so frustrating for you. So, I give you all credit, but make sure you're taking care of yourself too. Any more questions?
question? If there are no other questions, I just would like to add, the brain health team, we're looking for volunteers, come on and join us. We meet the second Thursday of the month, 10 a.m. in the conference room. And so please feel free to come and join us and get involved. And I'd like to just acknowledge that there are BHT members here. Thank you all for coming out. Thank you all. And we hope to see you next month again for another topic, and in March, another Alzheimer's topic. So thank you very much once again. And I'd like to thank Joan. And if you have any questions, please call the hotline. It really, really is worth your time, and they don't mind giving their time. Thank you all.